Hello everyone, I am Jason May B. Villano and today I will be performing a return demonstration in giving and removing of bedpan. Now I'm going to start by gathering all the necessary articles. And then next is I have to greet the patient and identify the patient to ensure that the right patient receives the intervention, and then I also have to explain the procedure to the patient and what I am going to do. Now I will be preparing by wearing my clean gloves to prevent body fluids to contact with my skin. And then next is I will change the top sheet with the bath blanket by folding the top sheet to the front of the bed. Here we have to make sure that the patient is well covered by the bath blanket to provide privacy for the patient. And have the patient flex the knees and slip the bedpan under the raised buttocks of the patient. Since the patient is physically able, I am going to place a tissue paper near the patient and instruction her what she has to do. And I will have to leave for a while to provide privacy for the patient. And then after that, I will have to clean the patient. Now, in removing the bedpan, I will have to make sure that before removing it, it is covered, and I will have to assist the patient in getting it. And after that, I will have to wash the patient's hand and make her comfortable. And I will have to do the aftercare of the equipments. And I will wash my hands thoroughly. And I will record. Now I'm going to proceed in cleansing bed bath, so the first thing that I will have to do is to wash my hands thoroughly. And then I will have to explain the procedure to the patient and what I am going to do. I will also have to provide privacy for the patient. Now I will be removing the top linen and place the bath blanket. And now I will have to obtain water. And I will bring the water to the bedside of the patient. Position the patient near to the nurse's side and assist the patient in taking off the patient gown. And now we are going to place a towel under the patient's head. And now we are going to cleanse and pat dry the eyes of the patient, the neck, the ears, and also the face. And now we are going to spread the towel under the patient's arm. Now we are going to cleanse the patient's arm and the axilla with firm, long stroke. Now we are going to place the patient's hand in a basin of water with soap. And then we will have to rinse thoroughly and then pat dry. And repeat it to the other side of the hand. And then here we have to change the water. And then now we are going to spread the towel over the patient's chest, and we are going to rinse and pat dry the patient's back as well as the buttocks. Here we also have to assist the patient to turn so that we could properly rinse and pat dry the patient. And then after that, we are going to place a towel under the patient's leg so that we could rinse and pat dry. And then we have to place 1 foot in the basin and rinse it thoroughly. And we also have to repeat it to the other side. Since the patient is physically capable, we are going to instruct the patient to wash her genital area. And then now we are going to help the patient put on clean gown. Now I'm going to assess the patient's nail. If it is long, then I'll have to cut it. And then I am going to comb the patient's hair. And after that, we are going to make the patients comfortable and tidy up the area. Lastly, we are going to wash our hands and document the observation. And then now we are going to proceed and shampoo in bed. First is we have to assess the patient's need to have bed shampoo. And we also have to explain the procedure to the patient and what we are going to do. And we have to wash our hands. And we are going to assemble all the needed equipments and bring it to the patient's room. And now we are going to remove the pillow of the patient. And we have to make sure that the patient is lying diagonally across the bed. And we are going to place a rolled blanket under the patient's neck. And we also have to place a bath towel under the patient's head. And now we also have to place a rubber sheet under the patient's head. And now we are going to comb the patient's hair. Give 2 cotton balls and place them into each ear. And then now we are going to start wetting the hair and the scalp. And we also have to massage the scalp of the patient and put a shampoo and massage it into the scalp of the patient. And we are going to rinse the head with water and we are going to repeat it as needed. And put again a shampoo and massage it into the scalp. And we have to rinse again the hair of the patient. Squeeze out excess water from hair and remove air plug. And we also have to remove the towel under the head of the patient. We use another towel to rub into the patient's hair and make sure that it is partly dry. Now we replace the pillow with protected dry towel. And we give the pillow to the patient and we comb the hair. And we just have to leave the bath towel into the pillow of the patient until the patient's hair is completely dry. And lastly, we are going to make a graceful exit.